Good morning and welcome to this EU Flu Day event from the Steering Group on Influenza Vaccination. Today is the second EU Flu Day and our event today is entitled One Voice to Protect Populations from Flu in the Age of COVID-19. And we're delighted to have an excellent panel with us today, and I'll introduce them shortly. And also we will have a discussion with some of the wider members of that steering group on influenza. You can ask your questions in the Q&A function below. Please keep them coming and we'll answer as many as we possibly can. Please note that the event is recorded today and there will also be sharing some of the information on Twitter, where you can follow and join the conversation using the hashtag EU Flu Day. That one right. Hashtag EU Flu Day. So please follow and participate on Twitter and live in the chat. So I think that's all. The housekeeping. To introduce us and ease us into the day before we hear from Ab Osterhaus on some of the scientific aspects of coronavirus and flu. We have two distinguished members of the steering group. And first, let me introduce Ber Oomen, who is the Executive Director of the European Specialist Nurses Organization, ESNO. And he is also a member of that steering group on influenza vaccination. So please, Ber, the floor is yours. Take it away.
Well, welcome you all on this very special day. It's 14 October, European Flu Day. And I think this flu day will be more important than ever. We see so much going on. And it's really my pleasure to open this session on behalf of the European steering group. It's also a really pleasure to be amongst such a great motivated experts. They only do not work for the steering group, but they have huge caseloads, huge responsibilities, because there's a lot at stake at the moment in our health system. So influenza and vaccination is more important than ever. It's also my pleasure to welcome MEP Montserrat. She is also to us also a bit of a champion of vaccination. And I'm also very pleased to have us on board again on the session. So I'd like to also, on behalf of the steering group, I'd like to welcome MEP Montserrat for her opening words. Thank you.
Hello, good morning. I'm trying to open now. Okay, now perfect. Can you hear me?
Yes, looks and sounds perfect.
Perfect. Thank you very much. Do you hear me well? Because I not hear so much well to you. I don't know what's happening.
No, it sounds perfectly to us.
Okay, yes, perfect.
It's all good. Go ahead. Thanks a lot.
Okay, perfect. Okay, so good morning, everyone, and welcome. And thank you, Gary, for the introduction, Ber, for your welcoming remarks. And thanks to our steering group on influenza vaccination for organizing this webinar today. As a dedicated flu vaccination champion in the European Parliament and chair of the steering group on influenza vaccination, I'm delighted to be hosting this important event again this year. The name of this event is One Voice to Protect Populations from Flu in the Age of COVID-19. For me, it is really important to see so many different scientists, academics, and health workers joining forces to spread knowledge about flu and the importance of flu vaccination. Even before COVID, influenza had a very high and recurring impact on European populations and health systems. But when we launched the first ever European Union Flu Day last year, it was in a time with unprecedented challenge. The 2020 Flu Day brought together experts who emphasized the importance of flu vaccination as a public health measure during the COVID-19 pandemic, which was still ongoing and very serious crisis at the time. Speakers called on the European Union and member states to make sure that the elderly and other at-risk groups were protected against seasonal influenza, not only for their own personal safety, but also to ease pressure from health systems in an extremely challenging time. We didn't want to see a severe influenza season in the middle of the COVID-19 pandemic. Fortunately, many people did get their flu jabs last year, and the vaccination got some of the highest rates ever in all the European Union countries. This was achieved thanks to the great collaboration between all the stakeholders in terms of planning and rollout of flu vaccination programs, as well as strong public communication campaigns, which raise awareness among our citizens on the importance of the vaccination as the best measure for disease prevention. Nevertheless, this flu season is likely to be different. As societies open up from lockdowns, like what is happening in my home country, Spain right now, and people are allowed to hug their loved ones again after the social distancing measures, we are at much higher risk of being exposed to viruses. Because of lockdowns and dramatically reduced social contact during COVID-19, there were much lower rates of flu in last year's seasons. A year with very little flu also means that we have lower levels of population immunity. So this is something that we'll hear more about later in today's discussion, but without a high uptake of flu vaccines, we could see a huge surge in flu cases. In times of COVID, this is not good and will strain our health systems and put people, especially the vulnerable, at much greater risk. COVID also showed us the level of fragmentation in terms of approaches to vaccination across Europe, with difference in both recommendations and implementation. Unfortunately, this has had a negative impact on vaccine confidence, which urgently needs to be addressed so that it does not stay a long-lasting consequence from the pandemic. Today, in the 2021 European Union Flu Day, we will set up the scenario, focusing on the challenge and exchanging the possible solutions for today and for the future from the different perspectives of all the involved stakeholders at national and European Union level. So let's start to learn from our panel of experts, and please stay tuned and enjoy the discussion. Thank you very much.
Great, thank you so much for that, MEP Montserrat, and I know you'll be staying with us for the panel discussion later on, so I'll save my questions until then. As you said, we have a very diverse panel and diverse steering group that were involved in putting this together. And it's very important, of course, to begin maybe with some science. So for that, we'll turn to Ab Osterhaus, who is the chair of ESWI and also a member of the steering group on influenza. ESWI, for those who don't know, is the European Scientific Working Group on influenza, and has been working on this for a very, very long time. And it's here to talk about both flu and COVID. So over to you, Ab. Thanks a lot.
Well, thank you very much for your kind introduction. And dear participant, dear member of parliament, it's quite a good time now to talk about influenza. And especially, you see the title of my presentation is how COVID-19 pandemic is changing the flu season and flu vaccination. So what's going on? And as a matter of fact, I think it's quite important to realize that due to all the measures that we have taken to mitigate the pandemic, all the non-pharmaceutical intervention measures that were taken, we see that, and you see here on this slide, on the left-hand side, you see all these different viruses represented in different colors. And you see here by March to May in 2020, suddenly they started to disappear or virtually disappear. And especially some of the major ones disappeared. And that's quite interesting. These measures were quite effective, perhaps with the exception of one or two of these viruses, like the human rhinoviruses, which are quite difficult to combat, I should say. Well, if we then go on, then we see here indeed that after the relaxation in different countries, and this is the example of the United Kingdom here, where you see that indeed then around week 7, relaxation took place. And you see all these virus infections coming back. Yeah, so RSV, rhino, etc. But the interesting thing is here, if you look at the black line here, that's respiratory syncytial virus, RSV, mainly in children and older adults. It gives major problems. But the interesting thing here is that we see it happening in the middle of the summertime. We've never seen that before. So that really means that we have to be prepared for combinations of virus infections that we haven't seen before at different times. Here you see an article from the Economist, and you see here the Southern Hemisphere, where you see the respective countries here: Chile, New Zealand, Paraguay, South Africa, etc. So you see these different, and here at the top, Argentina and Australia. So interestingly, after the measures were taken, then indeed we saw in 2020, we saw indeed that influenza, basically it disappeared completely. So there was no influenza. And the question is, of course, what does that mean in the long run? It also means that people have not been exposed to influenza viruses, which means also that the herd immunity towards influenza has gone down. Well, talking about COVID and flu, signs and symptoms, to be honest, if you look at this list, you see all the pluses here. So definitely for the physician, it's virtually impossible on the basis of the clinical symptoms and signs to distinguish between COVID and influenza. You see here cough, shortness of breath, all these things that we know, although some of the clinical features as we know today are different. And of course, diagnostics for COVID-19 the use of diagnostics has increased enormously in the combat against COVID-19. So basically, if you go back to influenza proper, then we see, if you look at mortality rates, then we see indeed that if you look at, we see some very little mortality in the young children, in babies, and then we see basically mortality starts at, from 50 years onwards. And then the main mortality, we see that in people of over 65. So basically, this is a pattern that we also see to a large extent. We also see that in COVID. Many older people, although there are other risk factors as well, apart from age. So you see them here, the major risk groups for flu, for influenza, you see adults 65 and older, pregnant women, young children, people with asthma, respiratory symptoms, heart disease and stroke. Very important is diabetes, HIV, and you see here all these things. And then here I have put here also healthcare workers, not because they are at enormous risk for influenza, but of course they have to be vaccinated as well to actually protect their frail patients. Yeah, so it's very important that these people, that the healthcare workers are vaccinated against influenza to make sure that they don't pass on the virus to especially their frail patients. And when we then shift to COVID-19, you see it's exactly the same figure. Yeah, where I have put two circles around heart disease and stroke, cardiovascular disease, and diabetes. We have seen that, especially for COVID, diabetes is a huge risk factor, obesity as well, and then heart disease and stroke, and to a lesser extent, young children. Well, the interesting thing there is that young children can be infected, as we know already from very early on in the pandemic. But I think it's important to realize that young children, they can transmit the virus. Yeah, they can be infected. And we know for influenza, they're actually the major transmitters in the population. They go to school, they flock together and go back home again and go to the grandparents. So, and then I think a similar thing is true also for COVID, as we know today, that although usually they don't get very ill upon infection with SARS-CoV-2, the coronavirus, they do spread the virus, so they can be infected and spread the virus. So when we go on, and then we are all anxious now that with the relaxation of all the measures, that we may have COVID-19 and influenza coming together. And I already said that influenza proper may strike very hard this year because there's there's a lack of herd immunity or reduced herd immunity. We know from the past that if you really have had a year with very little influenza, the year after usually it's going to be influenza usually hits hard, and we have seen that, for instance, in 2018. Yeah, well, basically we see here that influenza and COVID, if they come together, they may be less severe due to all the measures that we have taken, but they are relaxed now. So this is not true any longer. But at the bottom, you see, it may be more severe if you get them together in the population at an individual basis. If you're being infected with both, and there have been some examples there that it may be more serious, but definitely also, of course, they're handling patients with severe COVID and influenza at the same time will give an extra stress for the healthcare sector. Well, then we talk about influenza vaccination, and at the flu day, European flu day, it's important to stress again, why do we vaccinate? Well, it keeps you from getting sick. That's an important thing. Yeah, it's an important preventive tool for people with chronic conditions in the risk groups, as I just showed you. Yeah, help protect women and their unborn during and after pregnancy, can be life-saving in children, and can reduce severity of illness in people who still get sick. So it doesn't always work to the full extent, but then still, if you're vaccinated, you're much more likely to get a very mild influenza if you get it at all. Yeah, and then perhaps a very important point, and I already stressed that for the healthcare workers, getting vaccinated yourself may also protect people around you, including those who are more vulnerable to serious disease. Well, and then the most important thing there, if we do get the two infections hitting at the same time, then really it is important that we have vaccinated the risk groups to reduce flu-associated hospitalization. That's an important thing, obviously, because then otherwise we're really stretching our hospital and ICU capacity. So I think that's the main message there. Get vaccinated against flu, and obviously get vaccinated against COVID-19 as well. Percentages are going up in Europe, but I think it's important, definitely for the risk groups, to not only be vaccinated against influenza, but also against COVID-19. Well, there are additional benefits of flu vaccination. It reduces complications of flu, and you see here all these things that we all know: pneumonias, ear and sinus infections, cardiac problems, asthma exacerbation, CNS problems, but also bacterial infections. It reduces antibiotic usage and AMR, antimicrobial resistance development, visits to the doctor, and visits to the emergency room. So all additional benefits for flu vaccination. And this also holds true, obviously, for COVID-19 vaccination. Well, although we know that protection is not always 100%, it may, in certain years, it may be less, but there is always a great benefit anyway. And I think it's important to realize, since we haven't seen flu in Europe in the last year or so, or virtually no flu, it may be difficult to identify the virus that should be represented, viruses that should be represented in the vaccine. But definitely, it is very important that we do get vaccinated. Yeah, so the effectiveness is variable. Even if breakthrough happens, yeah, so due to antigenic mismatches, the infections are likely to be less severe, as I said before. A very important point, similar to what we have said for COVID vaccines, influenza vaccines are amongst the safest vaccines in the world. And if vaccination coverage is high enough, and an influenza epidemic can be mitigated, and definitely the hospitalization levels can go down through herd immunity. And it is important that the R naught of influenza is relatively low. So the virus is spreading, but it's, from that point of view, is relatively easy to combat. And now I'm coming to my recommendation slide, and this basically is my last slide. Yeah, so I think on the basis of what we have just said, that influenza in the COVID-19 world, yeah, it's important to realize that we have to be prepared for the reappearance of both influenza and COVID in the fall of 2021. And for influenza, it's clear, I just told you, but we should also realize that there are still pockets of non-vaccinated individuals that are susceptible to COVID-19, but also people who cannot be, in who the vaccine doesn't work optimally due to all kinds of conditions. So it is important to increase both COVID-19 and influenza vaccination coverage. And it's particularly crucial for the high-risk groups. And I already mentioned healthcare workers for flu, but the same obviously holds true for COVID. Yeah, minimum coverage of these groups, according to the European Commission, should be 70%. So we should go over 70%, yeah, with our vaccination levels in the risk groups to be successful. But that's no limit. We should even go higher if that's possible, especially now that we are living in this COVID world. Yeah, we should be prepared to stock and use flu antivirals as well. There are good antivirals for flu. So if you have not been vaccinated, or in spite of vaccination, you still develop disease, which might happen sometimes, then it's important to have antivirals, specific antivirals for flu available. We have that. Yeah, and obviously it's very important that the whole network of flu surveillance, yeah, and testing, yeah, that is happening in all over the world is orchestrated by WHO. But this system works very well also in Europe, that we really know what's going on in terms of spreading of the virus. But also it's important to test for flu, but also look at other respiratory infections such as RSV, and obviously also SARS-CoV-2, as we have said before. So basically, with these recommendations, it boils down to really get vaccinated against both influenza and COVID-19. And this holds specifically true for the risk groups and definitely also for healthcare workers. Thank you very much.
Thank you very much, Ab. That was really excellent and eye-opening. You mentioned at the end there testing and surveillance. Do you think all the infrastructure that's been built for testing and surveillance of COVID will help catch more flu, or is it actually replacing and complicating the task of surveillance?
Well, obviously the COVID testing at the moment has become kind of a routine, even in the GP office. You know? So basically we have the theoretical possibility to do the same for flu, but usually it's not happening. But of course, at a national level in different European countries, yeah, basically it's being followed. So we will be alerted for sure when flu starts. You know? So we should realize that when flu starts, it is rather late to get vaccinated. So the advice today is indeed to get vaccinated really now in October, November, to be well prepared for a possible serious outbreak of flu. Although I should say immediately, whatever we have predicted for flu in the past never came true. So let's hope, that's the hope for the future. So I expect a very serious flu outbreak this winter time, but knowing flu, I hope I'm completely wrong.
You mentioned some other viruses. I think when the kids went back to school, there were plenty of rhinoviruses going around, and as you showed, also RSV. How much more infectious, although you said the R0 was low for flu, you know, if we see lots of RSV, do we tend to then see more flu, but maybe a little less severe?
No, well, I think the threshold for the threshold for rhinoviruses is relatively low. I think for RSV, we have seen an outbreak in the middle of the summertime in some countries, not in all countries. And I should immediately say the pictures I showed were for the US and the UK, yeah, which doesn't mean that it was the same in all over the place. But basically, the measures that are effective against COVID were also effective against flu. But obviously, we are relaxing them today. Yeah, and so the schools are opening again. Children in many of the countries do not have masks any longer. So I think a very important thing is testing, as you said, testing. Also, if we have all these discussions about classrooms where you have a child that is infected, should we send home the whole classroom, yes or no? These are very in different countries. So I work in Germany and live in Holland. So I see the discrepancies between the countries there. But I think it's important that we have the possibility to test, and also for young children before they go to school. If indeed you have a case in a classroom, yeah, there's nothing against testing the class, the children in the class before they come into school, just to pick up the children who are infectious. Yeah, so infected, not only infected but infectious. That's the main thing, and that can be done with the simple antigen tests that we have to date. Yeah.
Okay, interesting. Normally, as you mentioned, we look to the southern hemisphere when deciding which flu strains to include in the vaccines. what can we learn from the Southern Hemisphere this time, given that it looked quiet? It's a bit of a strange season. It's like they're having their version of our winter last year now. So are we in the dark really this time?
Well, we are definitely not in the dark, obviously. Flu has been circulated to a low level. The WHO has just had this strange selection meeting. So basically, on the basis of the limited circulation, you could already do predictions, but the predictions are not always good. And I agree with you, it's more difficult this year. Yeah, because relatively little possibilities have been there for the virus to explode or to really disseminate its themselves on the Southern Hemisphere. So there is a little bit more of a gamble than it is in other years, yeah. But usually the vaccine is protecting reasonably well. And I think even if we are talking about more limited protection, like we have seen in some years, then still you can have protection in the order of 50% in the elderly, which of course 50% is not everything, but it mitigates also the disease that does occur. Yeah, so basically in that age category, let's say people over 70, for instance, medicines that work for more than 50%, that's already a good score for that age category. So there's always, people always criticize that these vaccines don't work for 100%. There's no vaccine that works for 100%, but for flu, it's always a bit of a gamble. And especially as you said this year, it might be more of a gamble, but if you're lucky, we have a good protection. So let's just take for granted that we may have a worst case scenario, and everything that goes better is an advantage then.
Okay. Indeed, we saw some very positive news about a malaria vaccine recently, where the effectiveness is even less in some instances, but obviously in the population it could make a huge difference. There's a question in on the Q&A from Susanna Palkinen. So she thanks you for highlighting risk groups. You mentioned asthma, and the question is whether or not other respiratory diseases are also of concern. I suppose we're thinking of COPD and other conditions. Is it specifically asthma, or are you thinking of other pulmonary issues?
Basically all chronic respiratory disease, yeah, and asthma is a thing that exacerbates, of course, yeah, but COPD definitely, those people are in the risk groups as well. So any chronic respiratory disease or predisposition for respiratory disease, yeah, which is asthma. So indeed it is both.
Okay, so we've been talking a lot about this coming flu season, but I'm sure I've seen you give presentations about potential flu pandemics in previous years. In terms of how this experience has prepared the world to deal with a flu pandemic, do you think we're better now, or not?
Well, if you heard me before, I'm quite cynical there. After the swine flu, we had the last flu pandemic. The general attitude was, well, these big pandemics are of the past. This is all a media hype. This is all orchestrated by industry. And I've been fighting that heavily. Yeah, and also meetings in WHO and other places where we have stressed the importance of preparedness. I think we should have learned our lesson now. Yeah, the billions of euros that have been spent, yeah, on this particular thing, let alone the misery and the numbers of cases, the number of people who died. I think if we take this all together, yeah, then definitely I think we should be prepared better, and we should prepare in peacetime. Meaning that we will, and something I can guarantee you, that in the next 30, 40 years, and probably earlier, we will have another flu pandemic, and it may be as devastating or even worse than the COVID pandemic. And you've seen how much it has cost us. Yeah. So basically, let's invest there in terms of making better vaccines that are broader protective, making better antivirals against different virus groups. Well, you talk about the influenza viruses, talk about coronavirus, a couple of other groups. So we should really invest in that, but not only vaccines, also antivirals, also biological response modifiers. Look at what dexamethasone has done, for instance. It's fantastic. So these kind of things we should learn in peacetime and then of course be prepared also for the non-pharmaceutical interventions, like having available the masks, having available the protective clothing, etc., for people working in hospitals, but also people in the population at large. So I think really, and I know that I can say this today and everyone will agree with me, but if we come back in 2 years, people might have forgotten again. And I think we should keep the pressure on. And for today, of course, the most important thing is that we get vaccinated against flu, but also we are working with many groups in the world on making flu vaccines that give broader and longer lived protection, so that that might eventually protect against any flu that might come up. We are not there yet. But an investment there is like investment in an insurance policy. If we can really prevent the next pandemic, and nobody, once it's successful, we will all have forgotten again. Nobody will applaud us. But if we can do that, we save millions of lives, yeah, and we save economies, etc. So really, my message is invest in peacetime, yeah, in all these things I just mentioned.
Great, thanks a lot for all of that. Stay with us for the Q&A later on, and if you'd like to ask a question of any of our speakers today, don't hesitate to use the Q&A function. So we'll move now to our panel discussion. So I will bring back MEP Montserrat and introduce Pasi Penttinen, who's the principal expert for coronavirus and influenza at the European Centre for Disease Prevention and Control, and Richard Peabody, who's team lead for high-threat pathogens at for infectious hazard management at WHO Regional Office for Europe. Pasi, I imagine as the principal expert for coronavirus and influenza, that you had a different title about 2 years ago, and you were probably an influenza expert also. So how do you see the impact of COVID and how it has changed, you know, the flu season that's coming and all of the work that you're doing in this area?
I think it's a bit early to see all the consequences at this stage yet. I mean, we are still in the middle of the pandemic, although many of us were hoping that by the time that autumn comes, that we can start to wind down the response, if you like, and start to look at other things. Now we'll need to be sort of focusing on both a potential influenza season, potentially a bad influenza season coming at us, as well as the continuation of this COVID-19 due to the low vaccination coverage or suboptimal vaccination coverage in many countries at this stage. So we're in a difficult situation to make a full post-mortem, if you like, of the situation, but there will be many consequences. I mean, one, and some of those you have touched already on Ab's talk here. One of them for us will be definitely the consequences for respiratory virus surveillance. We've established completely different kind of systems now for COVID-19. I think there's a realization of the importance of this surveillance activity, not only for COVID, influenza, but other respiratory viruses like RSV also going forward. So we'll need to assess those and see how much countries and health practitioners are ready to invest in keeping those systems running and going forward. There is the big sort of change, I think, in the popular understanding of the impact of respiratory viruses and pandemics. And there, I must say, I tend to fall into the camp that's also Ab was falling into, that it's you know, having gone through the H1N1 pandemic in 2009, one would have thought that we learned the lessons then and had the resources, had the general political will and the popular support to strengthen our preparedness and our response capacities for these kind of situations. But we saw that dwindled in 2 years after the end of the pandemic, despite the sort of a daughter of that virus still circulating in the world. So it remains to be seen. I hope that's this time, given the unprecedented impacts of this pandemic, we will have something more on our hands for the future years to combat respiratory viruses, influenza also, and other pandemics. Maybe I'll leave it at that, and we can take it forward.
Okay, sounds good. Richard, maybe I could bring you in. I know WHO Europe has a bigger region to deal with, of 53, I think, member states. How have you seen it across the European continent in terms of the impact of COVID on the coming flu season?
Yeah, no, thanks very much. I mean, I echo many of the messages that have already really been given, but I think important to highlight that obviously the European region is the wider WHO European regions, 53 member states, is a very diverse geographical area, economically and politically. And that's really also now being reflected in what we're seeing in terms of those different areas that Pazzi highlighted. So in terms of surveillance, in terms of disease epidemiology, in terms of the vaccine programs, and the implementation of public health measures. So I think, again, in terms of, you know, the surveillance systems, what we've seen is, of course, the pandemic has initially had actually in many countries a hugely disruptive effect actually on existing influenza surveillance infrastructure. But most countries have then risen to the task of actually creating and building really strong systems to monitor COVID-19. And what, you know, we're really pushing now is for the development of integrated systems, integrating flu and COVID, so that we've got sustainable systems in place as we move forwards, which can last for the future. Because there's been huge investments made by countries in the pandemic, and we really need to make sure that those investments pay off in the long term. In terms of the disease epidemiology, I mean, clearly the pandemic, as we heard and as we've seen, has had an unprecedented impact on the epidemiology of influenza. Really, virtually no influenza circulation for 18 months since countries introduced their public health and social measures back in the spring of 2020. And now that obviously countries are starting to open up, international travel is restarting, we are seeing again the resurgence of a range of different non-COVID respiratory viruses, including some early signs of influenza already in the European region, which might herald what's to come. And it's always a difficult game, but there's clearly concern that this winter may be extremely busy on the influenza front. And that, combined with the circulation of SARS-CoV-2, is a twindemic and can really stretch many countries' healthcare systems. And then on the vaccine program front, which is clearly, you know, an area we want to sort of focus in on, we know that countries have made amazing efforts to roll out the new COVID vaccines. The success there in the wider European region has been quite mixed, actually. So some countries have been hugely successful in achieving very high coverage. Other parts of the region, they've still got a long way to go. And we're seeing that in the current epidemiology of COVID-19, where the mortality impact is, particularly in the eastern part of the region, continues to be really significant, actually, and also the healthcare impact. And that actually also reflects to some extent the historical uptake of flu vaccines, that there is this inequity in both access to and uptake for influenza vaccine across the region. I think that my key message is really around, let's take the opportunity now, get good vaccine uptake for flu vaccine as well as COVID-19, really across all the countries of the European region, and try and mitigate the impact of these important infections.
When you look prior to COVID, what was the picture like for vaccine uptake? You said it was quite mixed, but in the European region at large, was it, you know, single digits kind of uptake in some countries and then, you know, 60s and 70% in others?
I mean, it's a very diverse impact, and only really a handful of countries were achieving the targets that were sort of set out in terms of those 70-75%. WHO's got a 75% target for the over 60s. Very few countries were reaching those sorts of levels, and many countries had much lower uptake levels. And clearly, that's a huge missed opportunity. And we know that the burden of influenza across the region in terms of hospitalizations and deaths each year is really large. And these are really preventable preventable deaths and hospitalizations, that there is an intervention there. We know it's not 100% effective. The effectiveness varies season on season, but 50% effectiveness on average is a really important contribution actually to preventing this impact.
Okay, thanks so much for that. MEP Montserrat, could I bring you in on the question of differences, particularly looking in the EU? I know prior to the pandemic there were big differences in flu vaccine uptake, and we also see still big differences in COVID vaccine uptake. Do you think this will change, and what role could the EU play in improving things across member states?
Well, we are going to try. As a member of the European Parliament, I believe that the European Union has an incredibly important role to play. The WHO, Richard was explaining us, the WHO 75% target for flu vaccination coverage among at-risk groups and health workers, which was also reiterated in 29 European Union Council recommendation on seasonal influenza vaccination. Most member states are very far from these levels, but I'm convinced that much more can be done to get them there. In Spain, a national monitoring platform for COVID-19 vaccination was established to track coverage rates. So this worked very well to harmonize data collection between regions, and it's now being considered also for other vaccines. So similar measures at European Union level would be essential to help drive and measure progress. A monitoring platform to track vaccination coverage rates is something that I personally and many members of the European Parliament strongly call for in the report we recently approved in the Parliament on strengthening the ECDC. So I also underline it's important and welcome the Commission proposal in the report on the European Pharmaceutical Strategy that just this week we already approved it in the MV committee level. So we know that the European Union can achieve great things if we work all together under a unique coordination body. And the most recent example is the very successful COVID-19 European Union strategy to search for the vaccine and with the vaccination campaign. So we were allowed not only to get 80% of the European citizens vaccination with 700 million doses, but also to export and donate other 7 million doses. That is something no country has done in the world. So this was only possible because it built on cooperation, solidarity, dialogue, and a common vision of the scientific community, the industry, the member states, and all the stakeholders involved, with no health nationalism, as we unfortunately saw at the beginning of the pandemic. So I'm optimistic, and I'm sure that, from the Parliament and from the European Union Commission, we're pushing on this way.
Okay, thanks very much. And Pazzi, do you share this optimism?
So I think the dialogue has clearly changed, and I think these are very positive messages to hear. I think the driving factor for when we're talking about influenza vaccination campaigns is really a sort of good general understanding of the severity of this disease and the big population level impact it has. I mean, in every single winter during normal seasons, we have some countries in Europe who are really struggling to manage the situation with their healthcare services for a number of weeks during the peak of the influenza season. So the first thing is that we understand the consequences of influenza in Europe. And of course, the next thing is that there is political will to do something about it. And I think there's already the 2009 Council recommendation is a very clear signal into that direction. And any support we can get at the European level I think is hugely important in that direction. What was interesting in the situation with COVID was the rapidity in which the Commission and the European Union was able to agree on a common procurement for the COVID vaccines, which is of course one of those things which helped a lot in ensuring that the bottlenecks to have access to the vaccines are not there. And that was an interesting sort of dynamic, and I'll be interested to follow how that sort of impacts other vaccination procurement programs that we have. For example, the pandemic influenza joint procurement activities that are in place. So once we have those first building blocks, I think we're already in a good place. Then there's a lot of work to be done, and I think that's also underappreciated in terms of the actual campaigns to get the vaccines into the arms of those people that need them. That you have to have the understanding that you're going to need them. You can protect yourself with the vaccines. You can protect your closest one with these vaccines. But that's not all. You need to get the people to those places where the vaccines are administered, or you need to get the vaccines to those places where the people are staying. And that's a big logistical exercise. I mean, remember that most of our vaccination programs are targeting children, which are much easier to capture, if you like, with the programs and cover a large population. But when you start to talk about, for example, people with pre-existing chronic medical conditions, cardiovascular disease, respiratory disease, diabetes, these are groups of people that countries don't even have kind of a good overview of who are they. They exist in individual practitioners' registries and so forth. So it's difficult to even cover or measure how much of coverage do you have in those groups. And that's where the big bulk of the work happens. And some countries have done huge strides in that way. I mean, UK is always a model example of what they have been achieving on the healthcare worker fronts, for example, on this, and also with the childhood immunization program. Netherlands had incentives very much, I know, also initiated and driven by AB on this call, but they had extensive good initiatives on how to ensure that the GPs are committed to the work and they are covering their own populations in a good way. So there's a big chunk of work that is very practical, very sort of down to earth, but needs to happen. And that needs some advanced planning. It needs a little bit of resources. It's not hugely expensive. And now with the COVID situation, one thing which will be a new consideration that needs to be looked at is the possibility to co-administer the vaccines. If we're going to boost the doses for COVID vaccines, or where we are still rolling out the COVID vaccines, it makes a lot of sense to consider giving both of the vaccines at the same time, because these are the same population, these are the same people that you're vaccinating by and large. So you're saving a lot of the delivery and the administration costs by doing it in that way.
Okay, interesting. Thanks a lot. Richard, could I bring you back in on something that Pasi just mentioned about vulnerable groups, diabetes, asthma, and so on. So as he said, you know, in some cases we didn't have lists in lots of countries until COVID happened. And in other cases, perhaps health professionals in those specialties hadn't thought very much about infectious diseases. To what extent do you think COVID might have sensitized health professionals to encourage vulnerable groups to be vaccinated against flu?
Yeah, and I think it's a very good point, and I think there's definitely something that can be built on there as well. When we look at the uptake levels that have been achieved in the priority groups for COVID-19, so the elderly age groups, the clinical at-risk groups under 65, then the uptake levels achieved in most instances much above those that would have been achieved for flu. So clearly, sometimes the mechanism by which these programs are being delivered will vary for the COVID versus potentially for the flu vaccine program. But this is clearly a very good starting point to build up and hopefully increase year-on-year vaccine uptake for flu vaccine in these populations.
And do you think the WHO or even the ECDC have a role in sharing best practices? We heard a good example from Spain there. You know, the UK is particularly good surveillance data. Even on the communication side, there are some member states that are ahead of others. So how can they help each other, or do you have a sort of coordinating role there?
Yeah, no, there is work which is supported by WHO. It's called TIP Flu, Tailoring Immunization Program. So which it is intended very much along sort of trying to identify and support countries in implementing best practice to try and improve uptake in key target groups like particularly healthcare workers and groups such as pregnant women. But there's clearly a lot that countries can learn from each other in this area.
Okay, great. Okay, well, yeah, go ahead, please.
Can I put a quick plug on our e-learning for healthcare worker influenza vaccination campaigns? On our website, you can subscribe. So if you are running a program for influenza immunization campaigns of healthcare workers, we put together a few hours of electronic training material on our websites with particular good practice examples from across Europe, including the University Hospital of Barcelona, which did a fantastic job a few years back in increasing the vaccination coverage among healthcare workers to very high levels. And I think that's, for that very narrow target group, it's quite a helpful tool also to get some tips and tricks on what can we do with healthcare workers.
Okay, interesting one. Great, and I see in the chat, speaking of good practice, Anna Sarah Carnahan says that in Sweden, they're recommending co-administration of flu and the COVID booster dose when it comes to the standard flu dose, but not the high dose. Other countries have also gone this way, and perhaps it could be one for the future. So again, everyone's learning as they're going, so sharing any experiences is always useful, I think. Let's broaden things out a little bit. As I said at the beginning, we have several other members of the steering group here, and you can ask questions of all of them in the Q&A section at the bottom of your screen. I already have some questions to ask there. So I'll bring back Ab Osterhaus, who presented earlier. Also, Burr Ruman from the Specialist Nurses Organization will be back. David Sinclair from the International Longevity Centre in the UK. Emily Karafalakis, the Vaccine Confidence Project. Mariano Vota, the Active Citizenship Network, and Sibilia Kulici from Vaccines Europe. So thank you all very much. Let me just open up our questions because they have been coming in. Okay, let's see. So a question from Max Beckman. Who will I burden with these questions? Oh, sorry, I forgot to mention Susanna Esposito. Sorry, Susanna, from the World Association of Infectious Diseases. Thanks for joining us. Let's see. So on flu and COVID, is there any information about lives saved due to the measures implemented? That's a tricky one. I hesitate to throw this at anyone. Maybe I'll throw it to all of you if anyone wishes to raise a hand. Do we know how many lives were saved last year by not really having a flu season? Perhaps the question is what normally happens in terms of mortality. Pazzi, you volunteered yourself. Thanks.
Yes, well, maybe that's exactly the way to look at it, because it was such an unusual year, and we had this complete absence of influenza circulation. We can use the normal estimates that we get for Europe. The best and the most comparable estimates over time and across countries come from slightly complex method that looks at excess mortality. So this is looking at all cause deaths during the weeks of the year and calculating which part of those could potentially be associated with influenza. We've funded for quite some years a project called EuroMOMO, European Mortality Monitoring, that looks at this and comes up with annual estimates. And where we can see that it's highly variable depending on the circulating strains, but also slightly on the vaccination coverage and other factors. But on the normal years, we have tens of thousands of deaths, mainly among the elderly, as Ab was showing, in the EU 500 million or so population. But in the few years running up to the COVID-19 pandemic, when we had H3N2 circulating, which is the virus that really affects the elderly population groups, we had estimates which went way over 100,000 and over 200,000 deaths on a given season. So that's the potential that we can do with influenza vaccines, with the antivirals, with the non-pharmaceutical interventions, which I do think will come to the picture now as we go forward from COVID-19. Of course, not all of that, you would need to have 100% effective vaccine and 100% coverage of the population to save all of those lives.
Okay.
but it is an easy win to do to prevent this with the methods that we have today.
Okay, thanks a lot. One on patients, the role of patient groups. I mentioned health professionals dealing with high-risk groups, but maybe Mariano Vota from ACN, you could help us with this one. So the question is, what role can patient organizations play in reaching high-risk groups and communicating about flu vaccination? Mariano, I know you have a citizen's perspective. So how important is it to have so many, diverse groups speaking with one voice, to use the title of today's event?
Thank you very much, and greetings from Rome. From my perspective, it is crucial to be active and committed in long-term perspective in the field of vaccination and general prevention issues. And the title today is One Voice. The one voice I can translate with the alliance. And in this steering committee, we can identify expert healthcare professional association, the private sector, the endorsement of the institution, together with patient advocacy group and citizen society organization. This is crucial to be active in order to be recognized as a stakeholder in the context of the vaccination policy. After that, we can work in several ways. Just for an example, my organization together launched a European survey in order to better also reach civic information of the flu vaccination and COVID vaccination across Europe. We can imagine a way of focus, a virtual focus group across Europe. The steering committee is another initiative because it's a policy initiative. Third, last but not least, the European Flu Day that together we want to launch or to endorse is important, the event and this celebration, this high-level event, but it's crucial to put this event in the agenda across Europe in order to be celebrated across European member states, thanks to the patient advocacy group, citizens organization, the providers, stakeholder, private and public actors. When in 2002, we have launched the European Patient Right Day that is together at the 16th edition. This is now in the culture of huge actors across Europe. And I wish that also European Flu Day could become the same, to be recognized as a fixed appointment to be celebrated across Europe. And of course, patient advocacy group and citizen society can play a crucial role on it.
Great, thanks a lot. Thank you, Mariano. Susana Esposito, World Association for Infectious Diseases, you raised a hand. Did you want to reply to an earlier point?
Yeah, I would like to add a comment and to share my experience on the role of Patients Association for vaccination in children with high-risk disorders. During a meeting a while ago, we have organized a morning with all of the Patients Association and especially associations like those that follows that includes parents of children with asthma, as well as those of children and adolescents with rheumatologic diseases, as well as those with diabetes, are very interested in working together with pediatricians in that case, or in any case with healthcare workers for improving the awareness on influenza vaccination in these categories of fragile patients. So I really think that this kind of alliance is very important also in the pediatric setting. And I think that it is extremely relevant to work together because especially for severe or in any case rare diseases, these associations are very strong and can at the end share correct information to their members with we can say a sort of positive message and also an appropriate message on the importance of prevention and vaccination. So I really support this kind of alliance.
Thank you very much for that. David Sinclair, ILC UK, we were talking a little earlier on about the lives saved, but also focused on hospitalization. You know, a lot of the benefits are not just lives saved. So what is there to say on the case for investing in flu vaccination from an economic and social point of view?
Yeah, thanks, Gary. I think for us, it's really an area we've at ILC done huge amounts of work over the last few years. In 2018, the influenza cost our economies something like $30 million US, and we lost 159 million working days in the richest countries. So there is a huge economic cost of flu during normal winters. What we did a piece of work sort of looking at, well, what can you do about that? And you know, investing in prevention, investing in flu vaccination shows that essentially keeping people healthier means people work longer, they spend more, they volunteer more, and they provide more caring. So without a doubt, not only is there a cost of getting the disease and its impact, actually there's a real benefit of preventing people from getting it as well. In terms of then, I think what you need to do for me, and we you know, I should flag ILC UK working with Gary and the Coalition for Life Course Immunisation and other colleagues around the table as part of immunisation for all ages. I think there's a number of themes that come across for all of these organizations. One, and this has come up, is equity. We've got to make sure that we have equity of access for in terms of vaccination. There is a real inconsistency of who gets it both within and between countries. Secondly, an investment in prevention. If Canada can spend 6% of GDP on preventative health, then so can other countries, frankly. And then thirdly, as really addressing some of the practical questions. And there's a question in the, I see in the practical barriers. There's a question in the chat actually about sort of the, you know, how we make sure with some of the infrastructure, such as using pharmacies, such as using providing support for people to get to vaccination that we've done for COVID, we maintain for flu. And for me, that's an extraordinarily important barrier, and we do need to absolutely do that. So in short, there is a massive economic cost as well as social cost of influenza, and there is a massive economic and social benefit of vaccinating and preventing it.
Great, thank you very much, David. Maybe Sibylla from Vaccines Europe, could I ask you one of these questions that's popped up on my screen here? And it is, in terms of what the scientific and industry communities are doing to tackle influenza vaccination, you know, we've seen obviously innovation that led to coronavirus vaccination. Is there also research going on influenza vaccine innovation and even research on the co-administration of flu and COVID vaccines? So maybe you could tell us a bit about the research side from an industry perspective.
Absolutely, Gary. Thank you very much for the questions. Actually, there are several efforts in disparate formats. The first one is actually studying the co-administration between an mRNA COVID-19 vaccine, for instance, and a quadrivalent high-dose influenza vaccine. And these are trials that are ongoing, not to name necessarily the company, but trials are actually testing existing vaccines for COVID-19 and the influenza in a concomitant way to understand actually if they can be used together, or if there is timing between actually those vaccinations that needs to be assessed. So that's the first one. There is also in that effort studies ongoing with regards to combined vaccines, having in one vaccine, in fact, or in one injection, protections against COVID-19 and influenza. So this also has been started, and phase 1 and 2 trials are ongoing. And the last one is also the update with regards to the influenza vaccines per se, using new technologies, as we've seen from with the mRNA technologies that have been used for COVID-19 vaccines. And this is currently being assessed for a new generation, I would call it that way, of influenza vaccines. So a lot going on in the innovation space and with regards to the engagement of the industry in providing much more efficient vaccines that we have today, but also efficient in efficacy, effectiveness, but not only, it's also with regards to those combined vaccination abilities, within just one injection, keeps this opportunity to protect against several diseases, and innovation is happening there.
Okay, interesting. And do you think that the experience with COVID has led to an increase in interest in flu vaccination? I had my flu vaccine in a pharmacy last week, and there was a queue, and I don't think I ever saw that before for flu vaccination.
I hope so.
Yeah, okay.
I hope so for the protection of everyone. I sincerely hope so. I'm desperate to receive my flu shot as well.
Okay, well, stay optimistic. Ab, you have your hand raised. You wanted to come in?
Yeah, well, I think it's important to say as well that the European Commission, of course, is spending a lot of money in the meantime. So there are a number of IMI projects and other projects ongoing. So we are coordinating a very big project on the generation of a more universal influenza vaccine together with groups from India. So it's a European-Indian consortium. And so there are a number of these things ongoing. And I think it's quite important that indeed the Commission is funding these kind of things in their Horizon programs, but also I hope in the future, and not only for flu, but the same holds true obviously also for coronaviruses, but also for other viruses which have a pandemic potential. So basically broader vaccines, and of course we have learned a lot about the messenger RNA vaccines. When you would have talked about the vaccination platforms that are there, the messenger RNAs would barely have been mentioned. And we see this is a very dynamic field that really the messenger RNA-based vaccines have really made a difference. So I think it's important that given the costs associated with these pandemics, as we have discussed before, not only the economic cost, but also the economic cost, definitely investing in generating more universal influenza and other virus family vaccines. I think it's definitely the way to go. And we should applaud the Commission for indeed funding this and encourage the Commission to fund it even more in the future. Thank you.
Thanks a lot, Ab. I'd like to bring Emily in from the Vaccine Confidence Project, if I may. I'm sure it's been a busy year for your team. Emma, what are your perceptions of how the COVID experience will shape uptake or confidence in flu vaccines and other routine vaccines even?
Sure. Hi, everyone. Really glad to be here in this panel. So we're still sort of trying to understand the full impact, because I think it's also quite it varies quite a lot in time. So what we saw last year, for example, we were quite optimistic because we saw quite a big improvement in people's confidence. We actually have a study that showed that there was an increase in people's confidence in influenza vaccination following the COVID pandemic. So what you were talking about earlier, that people are queuing up, I think we've experienced that last year already. And that could be due to just people being more aware of respiratory diseases, having more sort of exposure to that positive information about vaccination. But we also know that it can really change very quickly, and people's opinions and confidence in vaccination really varies depending on the information that is available. So what we're looking at now is, for example, the impact of really the increase in misinformation that has been circulating around vaccines, COVID, but also other vaccines in general, and also the impact of things like mandatory vaccines and the laws and the restrictions on individual freedoms. And we know that has had an impact on the polarization of discussions around vaccines. So we've seen people with pre-existing negative views around vaccination sort of being even more negative about vaccination, and really creating that sort of debate, and the media hasn't helped with some of the framing of anti-vaxxers and all of that. So I think we're still optimistic, and I think, you know, we're hoping that we'll see more queues for influenza vaccination, but at the same time we have to be careful about barriers that we already know about. So in terms of lower awareness and people not seeing influenza vaccination as really something of value and something that's needed. So these we need, as every year, to really have strong communication around, but we also need to work on these extra sort of problems that we're seeing since COVID.
So on the communication and confidence side, I suppose everyone's quite focused on this, but there has been some discussion today about convenience, about just making it easier for people, or personalized communication. Your vaccine is ready at 11 o'clock on Tuesday. You know, do you think these lessons might be learned by how we introduce routine vaccines?
Definitely. So we know that a lot of the time it's about having that personal conversation, and it also varies from one group to another. But for example, we've seen that a lot with pregnant women. A lot of the time it's mostly about them not being aware, not being recommended the vaccine by the healthcare professional. So having that dialogue, having that discussion around their individual needs, and having more access. So some people don't see their doctors, they just see their pharmacists. So, and that's not only new with COVID. We've seen there were a lot of interesting trials in France that were done just before COVID, showing that it does increase flu uptake if you have flu vaccination provided in pharmacies. So yes, these are definitely all types of initiatives we have to work on.
Okay, great, interesting. I'm looking down the questions that are coming my way, and I think there have been a few maybe for MEP Montserrat, or that you might like to consider. So one is on still having very low flu uptake, even in risk groups. Perhaps this has been touched on already, but are there things at European level, or is it a national level issue that we could do to increase uptake in those risk groups? Will we ever get 75% everywhere? As we already have 70% at least in COVID, could we do this for flu?
Oh, if I can answer, I think that any occasion for administering a vaccination is an opportunity to increase the coverage against all the other routine vaccination. And in the case of influenza, I think that now, first of all, in some countries like Italy, for example, has been highlighted the possibility to co-administer influenza vaccination and COVID vaccination. This means that those that at the moment haven't been reached by COVID vaccine can receive both the vaccines together. Anyway, I also think that it is extremely important to work in the various settings with the strong alliance with all the stakeholders that are involved in the specific settings. So we spoke about the high-risk patients. In this case, the association of patients are very relevant. When we speak about healthcare workers, I mean, the direction of the hospital has a very important role. In Italy, for COVID vaccine, what has been done is to exclude from the national health system those that reject the vaccination. And I think that only working together, trying to push in increasing the awareness and in increasing the idea of the importance of vaccination in order to go against vaccine hesitancy. Only in this way it is possible to increase the coverage and to reach the percentage higher than 70% that Hub showed in his presentation.
Okay, thanks very much. MEP Montserrat, maybe I'll ask you a question that came here that's related. Do you think we need to restate or repeat or follow up on the 2009 Council recommendation on flu vaccine uptake? Is it time to have a new recommendation, or is it just about implementing the one we have?
Well, I think so that we have to achieve that recommendation. We have to be able, to achieve this average to all the state members. And then, before Susanna was talking, you were putting on the table another question about, who has to do it, who has to do more, state members of European Union. I think that both. I'm putting always the example, vaccination is the most effective measure of disease prevention we have. And the COVID pandemic once more show it. So the Union for Health we are building in the Parliament and in the Commission can have a big role in strengthening the efforts to promote influenza vaccination and secure the health of all the European citizens. So this is, European Union has a big role that we have to push for that from the European institutions. Second thing, what can the state members do? A lot. And now I'm going to put the example in Spain, in my country. Spain is one of the first 10 countries in the world with the highest rate of flu vaccination for people aged more than 65 during the last 5 years. So we reached the rate of 65% of people at risk vaccinated. This is the result of many years of highly coordinated efforts at national and local level, with very effective national vaccination campaigns implemented through the network of the primary care centers and family doctors in urban and rural territories. So the network is deeply connected also with the schools and care centers to implement also vaccination campaigns other than flu, with a shared national vaccination plan schedule through the year. So always I'm thinking, because this is working very good in Spain, to have this national plan vaccination schedule, and all the kids, our sons, they are in this national schedule. And always here in the European Parliament, always I'm having this conversation and with this initiative with the other state members, another metro and other state members, why we do not put this European vaccination plan schedule for all Europe. So let's do it. Perhaps it would be a really good tool, because in Spain it works very well. So I think that we have to work a lot from European Union, of course, European institutions and state members. So Mariano and Susana all the time they were saying, that we believe all that. I think that all that we are here today, we believe with this big alliance. So we have to push for this big alliance, and we have to involve European institutions that I'm sure that they are, and all the state members. But all of them, they have to put tools and procedures and campaigns on the table in the local, regional, state members level, and then to European Union level. So perhaps it is a good idea to put in the European level a European vaccination plan schedule through the years all around Europe. Could be a really good idea.
Okay, yes, that would be, I suppose, somewhat radical, but maybe this moment is the time to do radical things, to try new things. Burr, could I bring you in on this one? Health professionals have been mentioned many times. What role do you see nurses playing in increasing flu vaccination? And if I can ask a second part, do you detect some vaccine hesitancy amongst the nursing community also?
Well, Gary, thanks for the question. You see, when I started about 5 years ago, I didn't know anything about vaccination, flu, or whatever. No one knew about 2 years ago about COVID. Now everyone seems to be an expert. Everyone knows the bits, the parts. And so this whole phenomenon of bacteria and vaccines and viruses is usually important. But there was a survey done by the nurse students recently, and they asked, where do you get your information from on this issue? And there was no harmonization. There was a list of at least 20, and they go from Google, Wikipedia, and they ask a friend, a colleague. So where do they get the information from? There's hardly any good education. So that really makes it very fragile if you want to have them included in policy. You see, if I have the questions, you see, I go to Sibylle, I go to Emily, I go to Up. I really like the PowerPoint of Up, because I learn a lot, and that's really what the nurses like. also like to have just not only talking to them or lecturing, just but communicate them, get them at the table and discuss them and have them included in a project in the programs, and make them programs in their nurses and in the nurses narratives. And that's also a challenge for us today, because if you engage them, then you make friends, then you also make advocates. But so also what happened during the COVID and the hesitancy, the big issue was that very short after the pandemic came, it was very much the debate were very much by the epidemiologists, the virologists, the industry. And we are very, very pleased that the industry made this vaccines of COVID available, and also now this one on the influenza. But what nurses also like to do, they need to communicate with each other and also with the patients and also the civil society on the influenza. We need to avoid that what happened with the COVID vaccines, that they say what is in it, how is it made. How do I communicate with my colleagues? So I think there's we also talking about policy. We're talking about economics, great initiatives, and in the parliament. I think this is really important. But the challenges for us is just to bring this and have the healthcare professionals also at the table and to be able to communicate this very good data and research what is in. So because it has to be more fluid, and now we have to avoid that there's all very that we refer them to PubMed or very abstract research. So we have to move through, and that's also where we see a lot of work for us as European Specialist Nurses Organization. To work on this. So engagement, have them educations, just bridging to these healthcare professionals, and I think this is a crucial element for us for the very near future.
Okay, great, thanks a lot. I think people generally trust nurses quite a lot, so they have a very important role to play. Emily, maybe I'll bring you back because I mentioned hesitancy and trust. I think we know that confidence and trust can be lost very quickly, but did we learn that sometimes we're pleasantly surprised by how good uptake can be? I'm thinking of France, where surveys last year said it's going to be really, really low, and we know it was pretty low uptake in the flu pandemic in 2010. So is there anything we can learn about how people can change their minds to have a vaccine, even if they're a little bit hesitant?
Yeah, I think we've definitely learned a lot since, I mean, already previous to the pandemic and since the pandemic, and we've seen how different strategies have led to different results in different countries. I think the example of France is a bit of a funny one, because it's not necessarily building people's confidence, but it's more sort of building vaccine uptake, which isn't exactly the same thing. And if, yes, there was a very big uptake of vaccine following the recommendation, well, following the decision to make vaccines mandatory to attend restaurants and bars and all of this, we don't necessarily know what it has done to confidence in vaccination. And it is possible, as I was mentioning earlier, we've seen in studies in the UK, for example, that this type of legislation can have a backfire effect on people's confidence, especially the one that are already hesitant. And that, you know, could lead to problems with childhood vaccination, for example, and acceptance of other measures in the future. That being said, and taking that issue sort of on the side, putting that issue on the side, I think there are other things that we've noticed works really well, and that's really, I think, back to the engagement with healthcare professionals. And it's having that, we know that if people have a doctor that they can trust, they will tend to be more favorable and less hesitant towards vaccination. So we know that having that trusted relationship can have a really tremendous effect on people's confidence and willingness to take a vaccine. So I think that is really one of the key messages, is working on that, and that sort of face-to-face engagement, making sure that we listen to people and not judging them. So there's been again, learning from negative experiences, there's been a lot of judgment and a lot of negative sort of discussions around people that are hesitant. And we've seen that, on the contrary, if we try to engage them in discussions, understanding what their concerns are and addressing them one by one, that can have quite a strong impact as well. So really making sure that we understand what the issues are and we address them on a sort of non-judgmental way. I think that's really one of the key things as well.
Okay, great. Susanna, you raised a hand, please.
Yes, I raised my hand just to add a comment, because today we have spoke about fragile people, those with chronic underlying disease, but we forgot to mention the pregnant women. And I would like to highlight the importance of a vaccination against influenza during pregnancy due to the advantages for the mother and also for the infants in the first 6 months of life. So I think that this is extremely important, because now in the mind of these women, there is a lot of confusion, especially among, especially because of the suggestions that they receive from gynecologists, because they don't understand whether to receive COVID vaccine, influenza, pertussis, and when to receive them. Anyway, I think that for these three diseases, the advantages of vaccination during pregnancy has been documented. And in the case of flu, it is extremely important to work with a sort of interdisciplinarity approach with gynecologists in order to increase the coverage in this category.
Thank you very much, Susanna. I'm just looking at the clock. I'm thinking we should get some final thoughts. Maybe Ab, we'll go back to you. You gave us a lot at the beginning. What's your takeaway, or the one thing you'd like the audience to take from this event on Flu Day?
Well, I think the major thing is that now is the time to get vaccinated against influenza, and even if you, and that's definitely true for the risk groups, for the high risk groups. And we have seen a good outcome last year. I think the consequence might be that people haven't seen flu this year, that they might think that it would not be necessary. But I think the main message is probably more necessary than ever. Yeah, so flu vaccination one, COVID vaccination as well. That is the main message of today. And of course, all the other things that were said for the risk groups are important. And then also, as was stressed a couple of times, also for the healthcare workers, and they should be vaccinated. And if you look at the coverage of vaccination in healthcare workers in most of the European countries, it's not good enough, definitely. So we have to do much better there. Thank you. Okay,
great. Thanks a lot. I think in the interest of time, I'll just ask Bear and MEP Montserrat to say a final thought on what they would like people to take from this event. Maybe Bear, we'll begin with you. Briefly, if you can, because we have about 1 minute for two of you.
Well, I wasn't prepared to have this and have the last bit, but I really appreciate the participants of this event. As I see, there are more than 70 and a very distinguished group of experts on the speakers. So I really appreciate them all for joining in this steering committee. And I'll leave the last words for MEP Montserrat. Thank you very much.
Very good. Please go ahead with your final thought.
Thank you very much, Gary and Bear. I'm really glad to have had the opportunity to participate today in this very insightful discussion and learn from very high-level experts, which are the challenge and the solutions we can foster and apply today and tomorrow for the flu vaccination in Europe. I'm sure that today's discussion will continue in the same spirit of collaboration and engagement among all the stakeholders. That is the key for a successful European Union flu vaccination. And I encourage my colleagues in the European Parliament to help amplify the European Union Flu Day campaign to ensure it reaches capitals and citizens in all member states. And I call on the European Commission to take the recommendations we will be discussing today into account and lead the way towards higher flu vaccination uptake in Europe. So thank you very much to all of you.
Wonderful. Thank you very much. Thank you all so much for joining. Thanks for all your questions. They were great. Thanks for those who tweeted with #EU Flu Day. And for now, just wish you a happy Flu Day and get vaccinated if you can.